Make sure you put it in a height that's comfortable for you. Be careful when you're turning your patients. A lot has to do with the size of the patient and what they have physically wrong. For example, if you have a patient who's had spinal surgery, you may not be wanting to turn them up with their head up, but you need to know that. We're going to go back to look in your chart. Know what this patient's condition is and what positions you can or cannot put them in. A lot of times when you're going to pull the patient up in bed, and a lot of times you're going to get to the room and they're down here, if at all possible, get help. Ask the nurse, ask the nurse's aide, have another person with you when you pull them up. If you don't have someone and they're small enough that you think you can do it yourself, the best way is to put your arm under their shoulder and have them hold on to you here, this hand under their head and hold them under here. Ask them to put their knees up, to bend their knees if they can. If they can't bend their knees, you can catch the bed at the knees. Put the knees of the bed up. Grab them in the position we just said. Using your your legs and not your back. One of the biggest problems in the hospitals, a lot of therapists and nurses are constantly out with back injuries. Nurses and respiratory therapists have the worst back pain because they tend to want to lift using their back instead of their legs. And eventually you're going to end up hurting yourself really, really bad. So using your thigh muscles to grab them under here and have them grab you up here and then just pull. If there's another person, then that person will grab the other side. And then a lot of times you'll find that they have an extra sheet under them they call a pull sheet. It's a sheet that's folded up 3 or 4 times. 2 people grab each side. You have to bend their legs and push. When you're turning them over, you want to move this arm out of the way. You can move it out like this or move it up, whichever your patient can most easily do. You want to grab them, you want to ask them to bend their knees if it's possible. Maybe bring one over. Bring this arm over. You want to grab them on the crest of their hip and on their shoulder. Don't grab them in the middle because you're going to be pulling the spine and you're going to be twisting and you don't want to twist their body. The crest of the shoulder, the crest of the hip and the shoulder. And you want to turn them in one movement. You want to do like a log roll, and so the entire trunk is moving over at one time. You may have to put there she goes again.
What happens if that happens?
That happens. Go find your lawyer. Like, oh, I need my lawyer.
Lawyer stat.
Yes.
Your lawyer stat.
Yep, go find a lawyer. That's what you're going to need. She does it because she's cooperative.
Well, wouldn't the doctor need a lawyer?
Huh?
That's one of the things you look for. Arms may fall off.
Should be on the door.
Side effects
Yeah.
include
If you
loss
find
of limbs.
body parts laying on the floor, you may have a problem with it. But yeah, just make sure that you kind of log roll the body. Use pillows to support the patient as you're rolling them over. You can put a pillow under their head, a pillow in the back, a pillow in the front. A lot of times it depends on the size of the person and how heavy they are. The next thing you're going to do is you're going to do percussion. And the percussion is when, like you said, you're hitting the chest cavity and you're creating a vibration through the chest wall to move those secretions. You have to have a cupped hand. You don't want to hit them with your flat hand because that cup, air gets inside and it's that vibration of the air as well as the cupping that helps to vibrate the chest wall and move those secretions. Hitting them with your flat hand is not going to accomplish that, and it might hurt. And what you want to hear, what I want to hear when you do your checkoff is that popping sound. You don't want to hear that. You want to hear that. And you want to get a nice rhythmic motion going, like, not this. You want to hear, some people do it faster,